Colon cancer rates are increasing in patients under the age of 50 years old. We don't fully understand why, but we do know what people can do to reduce their risk. I'm Dr. Andy Thanjan, a gastroenterologist, and today we will discuss this trend of increased colon cancer in younger patients and what you can do to prevent it. Colon cancer has been rising in patients under 50 years old. They started to notice this trend years ago and changed our guidelines for when we start screening for colon cancer. It used to be 50 years old, but now it is 45 years old. This is important since this change has happened, I've seen in my own patients many people that have had colon polyps that I've removed that could have increased their risk for colon cancer or even diagnosed colon cancer in patients under 50 years old. This begs the question, why are younger people getting colon cancer? There is no one single answer, but it's likely lifestyle and environmentally driven. What are likely contributors to increased colon cancer in younger patients? One is the Western diet. This diet is a diet that is low in fiber, high in processed foods, and high in sugar sweetened beverages. Number two is a sedentary lifestyle without sufficient exercise. Number three is smoking. Number four is changes in the microbiome, which we are learning more about. What is the microbiome? The microbiome is the many bacteria that live in our colon that are important in terms of development of colon polyps and colon cancer and having the appropriate balance of these different bacteria. Sometimes these bacteria and their colonies or population can change with the increased use of antibiotics. Another contributor is the increase in metabolic diseases such as fatty liver, obesity, high cholesterol or lipid panel. What are warning signs that young people ignore? One is persistent abdominal pain, unexpected weight loss, bloody bowel movements, a change in bowel habits, or iron deficiency anemia, meaning a low blood count or hemoglobin associated with low iron levels in the blood. These could all be signs of colon cancer, and these are not signs or symptoms that a young person should ignore. So how do you reduce your risk? One thing is to maintain a healthy weight and exercise regularly. Another thing is to reduce processed meat intake as well as sugar sweetened beverages and eat more of a high fiber diet with plenty of fruits and vegetables. Limit your alcohol use and stop smoking. More importantly, if you have any concerning signs, to get that further evaluated, as well as to start colorectal cancer screening at age 45 and possibly sooner if you have a family history of colon cancer. The take-home point here is if you are having persistent bowel habit changes or bloody bowel movements for a few weeks, get evaluated. If you want clear, practical explanations of gut health by a GI doctor, please subscribe. I post new videos regularly.